Aspen Pharmacare has confirmed the release of the first supplies of Johnson & Johnson COVID-19 vaccines to South Africa from its flagship site in Gqeberha, Eastern Cape. The vaccines from a new API source located in Europe will be released to Johnson & Johnson from Aspen's Gqeberha-based manufacturing site later on today. It comes after President Cyril Ramaphosa pledged to substantially increase the rate of vaccination in the country in the coming weeks. Saad is the CEO of Aspen Pharmacare and joins us now. Very good evening to you, and thank you so much for speaking to us.
Thank you so much for having me. I appreciate it.
So let's just get some of the terminology right. So what we're talking here about is J&J vaccines coming from the Gqeberha site. Some of our viewers seem to, and I've seen some copy obviously suggest that it's J&J vaccines manufactured in South Africa.
Yes, that's right. So it's the J&J vaccine that they manufacture, that we manufacture on their behalf, and that is the product that we make in South Africa. So really it's the first African-manufactured vaccine to be released into Africa. So it's a proud moment to have something made in the continent for the continents, and we're very pleased to be able to partner J&J.
Okay, so you're saying it is made in the continent. So what has happened is that the necessary IP and scientific technological tools have been given to you for us to do that here in South Africa.
Yeah, so we get a supply of the drug substance, so that's what goes into the vaccine, and from there we manufacture the vaccine. And that's, I mean, as you can see in the pictures there, that's what I'm looking at now, is that, you know, that is the vaccine, the J&J vaccine being manufactured at Gqeberha.
So just talk to us through how have we gotten to this point, as in since the advent of COVID-19 and the point at which we knew that vaccines needed to be produced in order to deal with the virus, we have been talking about capacitating African countries to manufacture vaccines. What has been able to propel us to this point? What was lacking, and what have we been able to cover in terms of the ground to be able to reach this point?
Yeah, so Aspen had a vision to be in vaccines. It was a bold vision. This was prior to COVID, so you can't just build these facilities. We built much of it for our anesthetic portfolio, where we are a leading player globally. But we built with the capability to make vaccines. We always thought vaccines were going to be critical for the continent and for the world. And it took a fair bit of foresight to make these investments, but we did. And it's really come in incredibly useful now. I mean, if I can add, we were ready in April. And we would have been fine to release stock in April. It's a bit sad that what happened, unfortunately, was the drug substance that we received from America was globally found that it might be contaminated. And as a result, all of those tens of millions of vaccines we actually had to destroy. So it really is a pleasure to serve the continent. Obviously, we're very positive and very happy about today, but a little disappointed that it couldn't have been a few months back, particularly given where the wave has hit South Africa in the period post-April. But here we are. We've got vaccines. We're in a good space. The president has announced how many, what a good position we're in over the next 3 or 4 months to provide the country with vaccines, not just Aspen, but other suppliers as well. And so I think, we've really got to go out there and get vaccinated and make sure we get our country safe and get our economy turning.
So I believe these facilities, these new sterile facilities that you're using contain high technology, state-of-the-art pharmaceutical equipment and systems. Talk to us about this. What exactly is it? And if you can put it in as much layman's terms as possible so that we understand what is involved in the manufacturing of a vaccine.
Okay, I'm going to offend all the scientists when I do this. So what you're looking at in the picture is the packing of a vaccine. But before it gets packed, it needs to get filled. And it comes almost in if I could call it a 5-liter bottle of frozen substance. You thaw that substance, you mix it in a pot, and there it is there. You mix it, and you then from there it gets packed into individual vials, which are those little blue things that you see there. But that substance is a very, it's a biological substance. So it's not a chemical substance. So if you break it, you've got a biological scare. It's very much a live substance. So that manufacture is contained. In other words, you have to keep it in a certain area, and you make sure it doesn't get out of that area. So it's a very technical process. It requires a huge amount of skills. And those people that you see in these pictures are people that have worked day and night for the last 9 months to deliver to South Africa this technology and these vaccines. And I really take my hat to each and every one of them. Our country owes them a huge debt of gratitude. They've worked really hard. We'd never made biological vaccines before. And they've turned our Gqeberha facility and South Africa into one of the leading, if not the leading supplier to Johnson & Johnson. So a really fantastic performance, and it shows what South Africans are capable of given a chance.
And in total, how many doses are you expected to produce this year? I think the total number is 600. It's a 600 million euro deal, but how many doses? 500 million doses in total?
So we make our capacities are about 20 to 25 million doses a month, which is about 300. I think that's actual, that's the number of patients and in the arm. So if at full capacity, we probably make about 300 million doses a year. But we intend to increase that closer to between 400 and 500 million within the next 4 months or so. So we are going to increase our capacity. And our ultimate goal is to have ourselves in a situation where we have one person, one vaccine for Africa. That is our commitment. We can never again, as a country or a continent, be left behind so unequally in a vaccine race again. And from Aspen's perspective, we've made two commitments. One, to get to one person, one vaccine, and two, to try and work with the rest of the continent to start capacitating other countries in order that this vaccine capability is across a broader continent, not just South Africa or Aspen, but more broadly across the rest of the continent.
Well, thank you so much for speaking to us. That is the CEO of Aspen Pharmacare, Saad.